During the last 3 months of pregnancy, high blood pressure can pose serious medical problems for you and your unborn child. This is especially true if you have suffered from chronic hypertension before becoming pregnant. During pregnancy, elevated blood pressure can be an initial sign of a condition known as preeclampsia. To understand preeclampsia, you need to know a little about the circulatory system. As blood circulates through the body, it supplies oxygen and nutrients to the cells and organs. During pregnancy, the mother's blood supply also delivers oxygen and nutrients to the fetus. Inside the womb, the fetus is attached to the placenta by the umbilical cord. Oxygen and nutrients carried by the mother's blood pass through the placenta and along the umbilical cord to the fetus, supplying the elements needed for fetal growth and development. With the condition known as preeclampsia, high blood pressure is associated with a narrowing of the mother's blood vessels. This restricts blood flow to the mother's vital organs, and also reduces the supply of oxygen and nutrients to the fetus. Left untreated, this condition can lead to serious complications for both mother and child. Severe preeclampsia can place you at risk for liver malfunction, kidney failure, and a life-threatening stroke or seizure. It also increases the chance and risks of a cesarean delivery. For the fetus, severe preeclampsia can seriously reduce the supply of oxygen and nutrients. This can cause a smaller fetus and a premature delivery. Medical science does not yet completely understand the cause of preeclampsia. We do know that it only occurs with pregnancy. About 5 to 10% of pregnant women develop preeclampsia, the vast majority during the last 3 months of their first pregnancy. If you have high blood pressure before becoming pregnant, you are at greater risk for developing preeclampsia and should be monitored closely during your pregnancy. Recent studies indicate that preeclampsia may be inherited. So if you have a family history of the condition, you too are at greater risk and should be closely monitored for signs and symptoms. Statistics also show that teenagers and women over 30 have a higher risk of developing preeclampsia during their pregnancies. Preeclampsia has several warning signs. Elevated blood pressure is the most common warning sign. Other early warning signals include excessive weight gain, headaches and vision problems, excessive fluid retention, especially swelling in the face. Early detection and proper treatment are essential for the successful management of preeclampsia.
A couple of things in your examination today have me a little bit concerned. You've gained a little bit more weight than I would have expected since your last visit. I've noticed that you're having a little bit of swelling in your feet and ankles, and your blood pressure is just a little bit higher than it has been on previous visits. With your history of borderline hypertension, this has me a little bit worried about the possibility of you developing preeclampsia.
What does that mean?
What this means for you is that I'd like you to start to modify your physical activities somewhat. This is going to mean stopping work and trying to spend at least 4 hours a day at home.
When early warning signs of preeclampsia are detected, bed rest is usually the first precautionary prescription. In most cases, the need for daily bed rest will mean stopping your full-time or part-time job and foregoing all unnecessary activities at home. You should lie on your left side with your legs slightly elevated. This position helps to lower blood pressure, reduce fluid retention, and improve the flow of oxygen and nutrients to the fetus. Monitoring for preeclampsia usually includes blood pressure checks several times a week, collecting urine specimens for lab tests, and checking for unusual changes in weight. If you develop preeclampsia, you may need extra protein in your diet to help maintain an adequate flow of nutrients to the fetus. You should avoid excessive salt intake, which can increase blood pressure. Your doctor may also suggest that you limit or avoid caffeine and alcohol completely.
Carol, what we're doing here today is a non-stress test.
As part of the diagnosis for preeclampsia, your doctor may want to monitor the growth and development of the fetus through certain tests. Your doctor may also ask you to keep a fetal movement chart to help evaluate the condition of the fetus. To keep the chart, you simply record the times that you feel the baby move. If you are diagnosed as having mild preeclampsia and the condition does not worsen, you may be able to continue with home management. But mild preeclampsia can rapidly progress to a more serious stage, so early hospitalization is often prescribed to stabilize the condition. In the hospital, you will be observed and assessed daily. You'll be placed on a high-protein diet. You may be given medication to reduce blood pressure and prevent complications. After delivery, signs and symptoms usually begin to fade rapidly. But remember, if you had high blood pressure before your pregnancy, your hypertension will continue. After the birth, you and your newborn will be closely monitored for potential complications, but these are rare. Early detection, followed by bed rest, and close monitoring are the keys to successful management of preeclampsia. Your cooperation is essential. By following your doctor's instructions, you'll be doing all you can to protect your health and the health of your newborn.